Sometimes just putting implants into the breast isn't enough. Dr. Dunkley will be performing a procedure where he will be boosting that bosom with both implants and a lift. Watch it today on The Younger You. Welcome to The Younger You. Today on the show we're talking all about breast lifts with implants. Now, new statistics from the American Society of Plastic Surgeons show breast lifts have grown 70% since the year 2000 and breast implants have grown 35%. Here to discuss these procedures with me is Dr. Dunkley, who is a fellowship-trained cosmetic surgeon. Thanks for being here, my friend.
You're welcome.
Dr. Dunkley, I just want to get something across the line to begin with.
Okay.
Is it common practice to have a breast implant when you have a breast lift, and why is it best to do them at the same time?
Actually, a lot of physicians will do them at different times. They'll do a lift first and then put implants.
On separate days, you mean?
Yes, in separate surgeries.
Why is that? Why? Because we've always been told if you're already going under, why not have it all done at once?
Well, and that's why we do it together, is because most patients would rather get the surgery done at one time. But you're doing opposite things when you do a lift with implants. You're putting an implant in to expand the breast, but you're also doing a lift to reduce and lift.
Okay, tell me the two different type of implants that we can talk about today. Okay. Silicone versus
saline.
Saline. Okay, now we've actually bought some with us today.
Yes.
But first of all, let's just talk about the difference to begin with.
Okay, so there's two types of silicone implants and then one saline implant. Saline implants are just filled with an IV saline solution. They actually have a silicone shell, but they're saline filled. The silicone variety have a silicone shell and have some form of silicone inside of them as well. The reason there's differences is one of the silicone implants is a little softer. The silicone's not as firm. The other is a little more firm to prevent rippling.
Okay, now you've got three very different looking ones to me here, and they all feel differently. Let's start off with this one here. It's more textured. Is this silicone?
Yes, it's silicone on the inside, but does have a different line or a liner on the outside. So a textured liner is designed for the patient's body to come right down and attach to the texture to keep the implant relatively immobile.
Okay, and it doesn't look round. It almost looks like a tear shape.
Yes.
Or am I seeing things?
Nope, it's teardrop shaped.
Oh, okay.
So the silicone is so firm, if we made it round and a patient stood up, it would be obvious that they had a round implant. So with the more firm silicone, they make them teardrop shaped so that it looks more natural.
Oh.
Both lying and standing.
I have to say to you, feeling them, they're very heavy.
Yes,
and
they are.
Like, when I say that, I think to myself, if you're going to go bigger and bigger in size, so what size is this?
It should say on the back. So
oh,
that
right,
one
okay.
is a 350cc implant.
Is that big?
That's kind of right in the middle. That's
okay,
medium.
That's the average type that most women would be getting?
350 to 450 is probably the most common range.
And
so on the saline implant, this is the fill valve right here.
Yes.
And when we pull this little piece out, there's actually a one-way valve that we can put a little attachment tube to, and we use that to fill the implant. So these are empty when we put them in, and we fill them in place.
I had no idea. I was going to say, why do you need to have something that you can... I was thinking in my mind, if a woman changed her mind, you could go in and expand it and make it bigger, instead of replacing the implant.
Right.
That's not the case?
No, they give us a range, so you can go up about 50 cc's or down 50 cc's. It's usually not enough to make a big difference size-wise on a woman.
Okay.
It might help to even out some differences. But if you really wanted a bigger size, you usually have to go with a bigger implant because the shells are only so big, and if you put too much fluid in, it expands it round like a ball.
I got you. Okay. So I've seen lots of procedures, and we have done them as well, where we actually take the implant out. All right. Mm-hmm. Why can't you empty the implant whilst it's in, like drain it out and then take it out? Because it looks quite hard to take it out when we see that procedure being done.
Usually it's a little difficult to find this valve and get the fill tube hooked up to it.
Okay, I have so many more questions too, but we've got to go to break. Thank you so much. Coming up, we'll learn more from Dr. Dunkley about the breast lift and implant procedure he'll be performing before we talk to our patient, Rachel. I'm here with Dr. Dunkley, and we are talking breast augmentations today. Not necessarily a new procedure, and many are familiar with this type of surgery. But I wonder what has changed, if anything, in how you perform them. Okay. Dr. Dunkley, where do you prefer to put the implant, underneath the muscle or above the muscle?
I prefer to go under the muscle.
Okay.
There's a couple of benefits of that. There's more of you concealing the implant, so it's going to look and feel more natural.
Got you.
It also provides a little bit more support for the implant, so we're less likely to get drooping. So it gives
Okay.
you a better shape. And then there's some statistics that show it may improve or decrease the rate of capsular contraction.
Interesting. Let me ask you a question that a viewer wrote in. Can breast implants make breast cancer more difficult to detect? Interesting question.
Yeah, and it shouldn't delay diagnosis or detection. You will find on the mammograms they can't just do the standard 2 views. Instead of 2, they sometimes take 3 or 4 views to make sure they see all the breast tissue.
Should you ask for that if you go in for your mammogram? Should you say, look, I know you normally do the standard 2. It'll make you sound very professional, but I need 4.
Oh, the techs know. They always ask if you have implants.
Okay.
So.
Do you think having an implant, in your professional opinion, for a woman is more about self-confidence, or is it just purely cosmetic?
It's all about self-confidence. Most women come in and say, I want to look like I did before I had children. I want to feel more comfortable in my own skin, and that's my goal.
All right, got you.
I want them happy in their own
Well,
skin.
it's time to flick over to Rachel to find out why she felt she needed a breast augmentation and watch as Dr. Dunkley performs this amazing procedure.
My name's Rachel and I'm 22. I'm getting a breast augmentation and a lift.
Hi, Rachel.
Hi.
How are you?
Good, how are you?
I'm doing well.
Good.
So are you ready for your big adventure?
I'm ready.
Okay. So we're doing breast augmentation and a lift. Okay, good. And we're doing the silicone implants, right?
Yes.
All right, so we've got our saline implants here. This is the new style gummy bear, is what everybody refers to them. It's actually highly cohesive silicone. And then of course our standard silicone, which it's still our #1 implant just because it's the softest, feels the nicest.
I got out of a bad relationship 2 years ago, and so those past 2 years I've just been focusing on myself and my health. And I weighed probably 40 plus pounds from where I'm at now, and so I lost a ton of weight. And then this is just something I want to do because I feel like I deserve it for myself.
Okay, so any questions for me?
I don't think so.
All right, well then I have a few for you. First of all, what size did we decide on? 450.
I think, yes.
That's exactly right.
Okay.
Which means when we put them in place, we told you this, that they look a little bit smaller than when you're trying them on in a bra than they do when they're under the skin and the muscles. So that means you probably like the look of a 400, and we decided to go up about 50 cc's so that we would get the same look when they were inside of you instead of inside the bra.
High school was just not super healthy eating habits. It wasn't anything crazy or bad. It just wasn't, I wasn't taught good eating habits. So then I got into a relationship right after high school where you get super comfortable in the relationship and you just stop doing things totally for yourself. And then getting out of the relationship, I just focused on myself and my health and lost the 40 pounds. And then, like I said, your breasts are the first thing to go, and it's dramatic. It doesn't change with your body.
My nurse will be in to chat with you. And after she's seen you, we should be about ready to go. We'll get you into the operating room and get you to sleep.
Hey.
After the commercial, let's check back in with Rachel to find out a little bit more why she felt she needed these 2 procedures done. The following footage contains surgical procedures. It may be too graphic for some viewers.
I had several friends who went to Dr. Dunkley, and they were all super happy. I've had friends that have had breast augmentations done before from other doctors, and they're going to him to have them fixed. So that just kind of reified the fact that that was like a good choice for me.
When we put in implants, I guesstimate that the first 150 cc's is just going to make them a fuller cup of whatever they are. So a 150 cc implant would take a B to a full B. After that, every 100 to 150 roughly gives you another cup size. We did a 450 cc implant, so I'm assuming she'll be about 2 cups bigger, but it's not an exact science. Sometimes there's a little guesswork involved, and everybody's a little different too. People start out with a little more or a little less. They may be a little broader chest, a little narrower, so it depends on the patient too.
It wasn't Like going from being super large, and then it's not like they got dramatically smaller, they just obviously didn't match up with how my body was changing. So it didn't really affect me a ton in that aspect, rather than they're just not what they used to be. And obviously that's something you can't change with the gym.
When we're in surgery, we just usually make the incision about 4 to 5 centimeters long, and then through that length of an incision, I can insert almost all implants, unless you get into a really big silicone implant.
My friends and family support it just because they've seen how much time and energy I've put into working out and eating healthy and changing my life, that they think it's a good decision. I just want them to be proportionate to my body. I just want to feel good about myself, and not really have to worry about that after putting so much time and effort into my body. What I can physically do, this is just kind of something that's beyond my control at this point.
I've lifted up the pec muscle. There's a really nice space in between the pec major and the pec minor, and that's where we put the implant in. I'm going to go up to the top of my marking on the top of the breast here and over to the center. Make the pocket large enough for the implant. So as we're making the pocket, I'm constantly checking it with my finger, and if it gets too deep for my finger, I'll check it with the instruments to make sure that we have the pocket the adequate size, and I'm usually going by the lines I made in the preoperative area as far as determining where the pocket needs to be.
I don't really have any fears going into the surgery. I'm really confident in the doctor I chose and the procedure I'm getting done. I've met with Dr. Dunkley and his staff 3 times now prior to my surgery. They've answered all my questions. They've given me tons of information that I can use, and I just feel good about it.
So this thing has a really slick membrane on the inside. When we get it wet, it activates it, and then it lets that implant slide really easily on the inside there. A Keller funnel looks kind of like a cake decorator's icing bag. We use it to put the implant into the pocket so that we can avoid getting it in contact with the skin and any potential contaminants. So in the preoperative area, we always measure and mark the patient. When we have the implants in, sometimes things can change a little bit. It's a lot easier to take out some of the excess skin when there are no implants in place. So we always staple according to our markings in the preoperative area, and then sit them up to make sure that everything is right where we need it. It's kind of the measure twice, cut once philosophy. It's our second measure before we actually start making some skin incisions.
I would just make sure that you're doing it for the right reasons. It's something that you will benefit from. You yourself are going to feel better from it, not because your boyfriend or your husband or someone wants you to get it done, but that's something that's just going to make you feel more confident and just enjoy yourself more.
It's common to combine a breast lift with augmentation. A lift alone will typically make patients a half cup to a cup smaller when we repackage the breast tissue, even though I'm just removing skin on the lift. So often we'll put implants in with the lift so they can maintain their size or even be a little bit bigger and get more upper breast fullness. Naturally, breasts always lose the most volume on the top, and you get that scooped out look, and implants, even better than anything else I can do, will help get a nice round contour up there. An augmentation alone is definitely an easier surgery than the lift surgery, and there's less incisions. Surprisingly, the recovery is not too different because most of the pain actually comes from the implant portion of the surgery. We can do a lift alone, and pain-wise, patients feel pretty good. Although the incision's definitely longer, and therefore the bigger the incision, the more there is to the healing time.
People say that all the time, that you're too young or you should wait till after you have kids, but sometimes those are things that are out of your control that you can't exactly plan for when you're going to have kids, if you're going to meet someone. So my thoughts on it is, I'm young, I've worked really hard for the body that I have now, and I want to do it for myself.
When we get back, I'll be sitting down with Dr. Dunkley to discuss how he thinks the surgery turned out.
We figure out if they need a lift by where the nipple sits in relation to the crease under the breast. So once the nipple is below that crease under the breast, we think about a lift.
Well, usually at this time we are seeing the aftershots of our patient. However, Rachel wasn't able to make it in for today's filming. But not to worry, we're joined by Dr. Dunkley and two of his past patients who underwent the same breast augmentation and lift procedures. Crystal and Bridget, welcome to the show and thank you for stepping in for Rachel. We really appreciate it. Before we get started, I want to ask both of you your age, because to me you look pretty young. How old are you?
I'm 30.
30 and
25.
25. Okay, Dr. Dunkley, I want you to be honest with me here.
Okay.
When I hear 25, I thought you looked a lot younger than that as well. I was a little surprised at the idea of doing a breast lift and implant. Am I wrong in my thinking?
Well, there's no set age. If a patient's over 18, they're welcome to come in and we can discuss their breasts. And unfortunately, not everybody, when they develop, gets nice breasts. Sometimes they are droopy or saggy and they're just not happy with it.
Why did you both feel that you needed to do this?
Mine was after pregnancy.
Okay, common thought for most women.
Yeah,
Okay.
they became droopy and I wanted them back to, it's kind of funny, but I wanted them back to my engorged size, like when I was breastfeeding.
Okay, interesting. Is that a common ask? So when you're fully fledged breastfeeding, you loved that size that you had?
I got a lot of compliments. A lot of people said,
Oh.
wow, Crystal, your breasts are so big. And I was like,
Uh-huh.
yeah.
Have you had women ask for that before?
That's a common description.
Okay.
Women come in and say, I really liked the size when I was breastfeeding.
Bridget, tell us your story. Why did you feel you needed to have this done?
Well, I originally went in for something completely unrelated, and you know, I kind of talked to Dr. Dunkley about, you know, other things that maybe I wasn't happy with, and he was explaining to me that I could get a lift, but by doing that, that I would lose a breast size, essentially, because of how
That's
much
interesting.
tissue.
So that is normally the case. If you have a breast lift, you will lose a breast size.
Yeah, usually with a lift alone, you lose a cup.
Okay, interesting. Well, are you both ready? I'm dying to see your before and after shots. Let's take a look at yours first, Crystal. Okay, this is a side profile. All right. I wanted to, and I asked you off camera, Dr. Dunkley, is the word droopy or saggy the correct terminology? Because they do look low.
Yeah, that's exactly what I discussed with the patients. There's a technical term called ptosis, but nobody knows what that means. We just say droopy.
Okay, when you just saw that picture, how did that make you feel?
It didn't make me feel good.
You were like, get them out
Yeah,
of
I'm
here.
like, yeah, I love my breasts now.
Okay, Bridget, let's take a look at your side profiles as well. Okay, it almost looks teardrop-ish to me. Is that correct, Dr. Dunkley?
Yeah, we figure out if they need a lift by where the nipple sits in relation to the crease under the breast. So once the nipple is below that crease under the breast, we think about a lift.
Okay, we're dying to see your after shots. You ready to have a look at yours, Crystal? All right, let's take a look. Okay, is this the size that you were when you were in the midst of breastfeeding?
2 cup size bigger.
Oh, you actually went bigger.
Yeah.
Oh, so you told me a little fibby before. You just said, I needed that size only.
Yeah, I needed that size, but I went a little bit bigger.
Why bigger?
They felt good when I tried them on. They just looked good, and I was like, I was like, these are the ones.
So did your girlfriends and family say to you and your husband say, you know, there's a big difference after the breastfeeding when you had the implants done?
Yes, my family, they were all like, wow, you went really big.
Okay, okay. Well, I have to say it's in proportion for your body.
Yes.
Like, from an outsider, when I say this, you don't look overly exposed or you don't look too big. And I have to say, do you feel the same way?
I feel the same way.
Okay, that's all that matters. Now let's take a look at your after shots as well. Wow, they're a big difference. They look a lot higher from the side profile that we saw with the before shots for Dr. Dunkley.
Absolutely. That's the goal. We want them higher on the chest.
How do you, up and perky, is that what we say?
Yep.
How do you feel now you've had them done?
Like a completely different person,
Really?
honestly. Even before, I feel like I mean, I've had kids as well, and I also lost 60 pounds was
Oh my gosh.
the reason for, you know, why I did it, but completely, it's honestly, been a huge change.
Well, ladies, thank you so much for coming in. We really appreciate it. Dr. Dunkley, again, thank you so much. We really appreciate you being here. Breast tissue that is deflated after weight loss or pregnancy may benefit from a lift and an implant together. As we've seen from our patients, it can also restore your self-confidence, self-esteem, and make you feel beautiful all over again. And remember, true beauty is being the best possible version of yourself on the inside and out. Now, for more information about the show and Dr. Dunkley, please visit our website at theyoungeryou.tv, and I'll see you next week.